my pleasure to be here, and I want to give a special thanks to Velma, to the YWCA of the Lower Cape Fear for inviting me this afternoon. And I'm kind of like an old lady now. I got to have my water and my napkin. But it is a great pleasure to be here to talk with you. I'm also tremendously blessed because I just recently changed positions at the department, and now I am blessed to be the Deputy Secretary for Health Equity. And so I'm thankful to join. Thank you. It is a blessing, not an opportunity that I sought, but I'm a person of faith. And so I believe sometimes that God has a plan that we just have to line up with. And so I'm happy to be here to speak to you today about health equity. This is my first official speaking engagement in this role. And so I was up half the night thinking, what am I going to say? I've been in this role about 2 hot days. So of course I have plenty to say. And so I struggled and wondered, what would I say? And I think about my family member and friend, Pastor Maynard. I was thinking today, and I thought, I got some inspiration like a good old Baptist preacher. So I rushed to the office, and I said, this is what I need to say. So let me just start here by asking you a question. Has anybody ever told you that you're doing the most? I'm not the only one. So I'm the mother of 2 adult children, and they usually say it, and when they say it, it's not a compliment. Ma, you doing the most. And then sometimes, this is really what got me going today and gave me some Holy Ghost inspiration. Y'all pardon me if y'all don't know what that is, but my husband said, "You're trying to do too much, ain't you?" And I said, nothing. And I thought about that in driving here, because I wondered, sometimes when people say that to you, they're trying to help you out, right? They're trying to say, don't go too far, you need to slow down, kind of pull it back a little bit. Sometimes when people say that to you, they don't see what you see. They don't know what you know. They are not called to do what you have been called to do. And I thought about the people. I was reading the program and read about Miss Taylor and read about Dr. Burnett, and I read about these honorees today, Miss Bartful, Miss Briggs, Miss Lofton, and I thought, I wonder if anybody's ever told them that. You know, you're trying to do a little bit too much, you know. And sometimes when people say that, they don't think that you can accomplish this great task that's ahead of you. And sometimes we can't, or sometimes we can't do it on our own. But I believe, and I thought about this as it relates to the YWCA as well, and all of you who are trying to do a lot, I'm sure, to promote equity. Eliminating racism is no small thing. Empowering women is no small thing. And so I don't think we're doing too much, because people have given their lives. People have made tremendous sacrifice to make possible for us things that were not available to others. And so let's celebrate all of these great folks, these honorees today. I can't wait to hear more about what you have done. And so the other thing I thought about is that we bring to the table different experiences, different perspectives. Again, you know, my adult children, and I call them adult children. Some people think that's sort of an oxymoron, but I grew up in a culture where as long as you were younger than your mama, my mama told me, I'm always the mama. So I can call you a child and you 30-some years old, particularly if you still need a little bit of help along the way. But we all bring different perspectives, different experiences, and we start at different places. But we share, I think, a common goal, and I believe that's why many of you are here today. And so I want to talk a little bit about my start. And as I did more research on the Lower Cape Fear YWCA, I thought, hey, these my people. I grew up in Chadbourne. Columbus County is a part of your region. What would have happened? I wondered what would have happened had I known about your organization as a young child growing up in Chadbourne. It's a really small town. There's not a lot of people there. I looked today, I was looking while you all were having lunch, and there's about 2,000 people who grew up in that town. And so we have a lot of challenges that we're facing in small town USA in Chadbourne, North Carolina. And we face in that small town, I don't live there now, but my people are there, so it's home for me. We face a lot of the issues that people who you're trying to support face. And so I grew up doing this. Does anybody know what that is? A picture of? What is it? Mosquito truck. Between 1962 or maybe let's say 1964, when I was tall enough to run, we ran behind the mosquito trucks, and we thought that was the highlight of our evening. It was fun. Who knew that we were exposing ourselves to all kinds of toxins? And I pray, when I read about it, that they had banned, these trucks long ago, and that they are researching the impact of what this DDT has on people, women of color, women and breast cancer rates. I thought, Lord, bless us all. I grew up eating, do y'all know what that is? I grew up eating sausage out of a can. And if you never tried it, it's really good with grits. I'm here to tell you. I guess it depends on if you know how to cook it, but my mom did. I also grew up eating government cheese. And I don't know, you all may have had Asiago and Parmesan and all those other things, but I had government cheese, and it was incredibly good. Now, I don't know what was in it, and I can't say that it contributed greatly to my health, but it was certainly a part of where I started. And so I thought about some of those things. I heard as I was coming in earlier today, some folks on the podium talking about food. And food is such an important part of our health and our lives, and having access to good nutritional food is important. And it's one of those leveling factors, right? I know that people are talking about food deserts, and there are some people who don't have access to fresh fruits and vegetables, but that wasn't me growing up, because my family canned. And actually, when they mean canning, it's in those jars, y'all, for those of you all who don't know. But we had to pick string beans, and we had to shuck corn, and it was a wonderful experience. And I didn't realize growing up that gave me access to good, healthy foods. Having to grow up in Chadbourne, we're not known for a lot, but we do have strawberries, and we do have the Strawberry Festival. And so we grew up picking strawberries and picking blueberries, and we used to have to get on a truck and drive long distances over the county line to go pick blueberries, but that gave me access unknowingly to fresh fruits and vegetables. My grandmother would buy bushels of peaches, and we'd sit in the living room, and we'd peel peaches and lick your hands and eat the peelings, and it was some good living. But it's a part of one of those things that help protect me. That there are many risk factors. I talked about that. Running behind a mosquito truck might be a risk factor. But there were protective factors, and good food was one of those. Another one of my protective factors is my people, my family. And this is a picture of my mom and her 13 brothers and sisters. My grandparents have both passed, but there are 10 of them still living today, and they all live in the small town. There's some of those 2,000 people living in the small town of Chadbourne, and I think we're probably responsible for about 900 of them. And so we have a lot of things working for our benefit. I have all of those things that I told you about, growing up with the love and support of many caring people. But not everyone has that, right? Not everybody has the benefit of healthy foods, of safe housing. Some people grow up in places where there's stress, and we know the impact that stress has on people's health. Chronic stress. We want to know why people are dying from heart disease and high blood pressure. It's as a result of the many things that they impact. And so I want to talk a little bit about where do we find ourselves today. And the other thing I want to tell y'all, if you will excuse me, I forgot to put on my mic. I'm not sure who the young woman is who told me to do it, but if you'll excuse me, I'll do that right now. I'm good. See there? I'm good. I don't need to do that. Okay. And I got 27 minutes, so I'm going to talk a little bit faster. So where are we today? What are some of the factors, some of the stress factors that are impacting our health? Racism is alive and well. And it's insidious and it is systemic. We know that the death of George Floyd in 2020 really sparked conversations across the nation and helped us to be able to look at ourselves as a nation and evaluate what can we do, what has gotten us to the place where we are in a place where we're not valuing all human lives. And I do value Black lives. I value all human lives. People with disabilities are really struggling. And then most recently, just this past weekend, we had the shooting in Buffalo. So we're in a terrible state of crisis, and we need a lot of help. The other thing I wondered about is what would it be like to be a parent of a small child and be faced with the fact that there might not be enough infant formula on the shelves to take care of the babies. Now, we've heard at the state level that most of the major retailers in North Carolina are okay. We've reached out to Food Lion and Ingles and Walmart, and right now they're saying they're able to maintain their supply. But I didn't look up, but I wondered how many women of color breastfeed these days. And so if you're not a breastfeeding mother, then you're dependent on formula being available. And for some people, it's a very frightening thing. We worry about, as parents, our babies, are they, gaining weight fast enough? Are they thriving? And to not have or to be worried about not having access to infant formula, I'm sure, is a great concern. And then I want to talk a little bit about something that is a terrible, terrible tragedy that we're all facing, which is maternal and infant mortality. We know that Black women are 3 to 4 times more likely to die from pregnancy-related issues. American Indian women are 2 times more likely to die of pregnancy-related issues. Infant mortality in the state of North Carolina for Black and American Indian babies is 2.5 times higher than that of white infants. And can I say to you that that increased infant death rate among Black and American Indian babies is happening even though we're at the lowest rate we've been in 9 years. So where did we start? And how tragic is that? So we are facing a lot of stressors that we are going to have to address. And so what is the department's perspective? Oh, I can't move past the elephant in the room, which is COVID. So COVID-19 laid bare what we knew. I heard something the other day. If any of you all get a chance, I'd encourage you to watch this documentary on the Smithsonian Channel called The Color of Care. Oprah Winfrey partnered with the Smithsonian Institute to produce this documentary that talks about the disproportionate impact on people of color of COVID-19. And what we know is that more Black and brown people have become infected with COVID, and more Black and brown people have died from COVID. We also know that there are long-standing and continuing racial and ethnic injustices in our healthcare system, and that has contributed to mistrust, a lack of trust in the healthcare system. And so the Department of Health and Human Services is really encouraging people to get the vaccine. That is one of the ways that we can protect ourselves from this virus. But there are many people who are so distrustful, who don't believe that the vaccines are safe and effective. They are. I've had them. I've had the vaccine and I've had the booster, and I'm healthy and well and thankfully have not contracted COVID. But there is a lot of mistrust, and we'll talk in a little bit about why people are so mistrustful of the healthcare system. And then COVID has had a major impact on our economics and on people's finances. I looked at this information from the Pew Research Center that said About 49%, or almost half of workers who have personally lost wages during the pandemic, are still earning less money than before the pandemic. So that means that people are falling further and further behind financially. So what is our perspective on health equity? What does the department want to accomplish? We believe in order to achieve health equity, we must acknowledge that social drivers of health and systemic stressors, those that I've talked to you about today, including racism, classism, sexism, geography, access, social, economic, and social opportunities, have contributed and continue to contribute to many stressors experienced by historically marginalized populations. And those are people who are often identified by their race, their social and economic status. And so we're going to have a little bit of an interactive section. I want to talk a little bit about what are some of the contributing factors to the mistrust that we have, some people experience with our healthcare system. So let's start here. There was a movie produced a few years ago called Miss Evers' Boys. And what we learned that in order to track the progression of syphilis disease, certain researchers provided no effective care in this study to African American participants who were experiencing severe health problems. And those problems included blindness, mental impairment, and in some cases, death. This refers to what? The Tuskegee experiment. And I am married to a black man who is very mistrustful. And you can understand because people have had or have learned about and heard about experiences. I also want to talk to you about another contributing factor, and that's the Eugenics Project. For 4 decades, states across our country forcibly sterilized people. In North Carolina, that was about 7,600 people. We have this date between 1933 and 1973. There's some studies that said it began as early as 1929 and went to 1974. Many of the women, it was women and men who were sterilized, but many of the women were on welfare. There were many women of color, although there were also white individuals as well. And so many of the states chose to end their eugenics program, but there was one state who chose to continue its program past World War II. Any guesses about which state that is? You got it. North Carolina. And then another and final contributor to some of the historical traumas that people have faced. So Oprah Winfrey starred in a movie that depicted the life of this woman. She was a mother of 5 who started experiencing health problems and sought treatment at the Johns Hopkins Hospital in 1951. She was eventually diagnosed with cervical cancer and treated by a physician who was collecting cervical cells from women to do research on cervical cancer. What they discovered is that most of the cells, this was Dr. Gray, discovered that most of the cells that he collected would die very quickly, usually within 20 to 24 hours. But this particular woman, they discovered that instead of dying, her cells would double about every 20 to 24 hours. And although she passed on October 4th, 1951, her cells, called HeLa cells, are still being used today in various studies. And I understand that they're also being used in the study of COVID-19. Does anyone know this movie or who this person is? Henrietta Lacks. So we have some great challenges ahead of us to overcome the historical traumas and to help us respond. But we did make some progress during the COVID pandemic, and I'm going to share a little bit with you about some of those successes. What we learned is that racism through our social, economic, and healthcare systems has caused unequal access to care. In some cases, it's caused maltreatment and neglect of historically marginalized communities. And as I said earlier, these long-standing and continuing racial and ethnic injustices in our healthcare system contributed greatly to the lack of trust in all kinds of treatments, but particularly in vaccines. And so what we're doing is we're drawing upon the experience and expertise of leaders like yourself in historically marginalized communities to help us develop and implement our vaccine plan. What we discovered with our COVID strategy was that we needed to build equity into everything that we did when it came to our pandemic response. So one of the things that we did was to embed equity advisors and equity considerations in our COVID operational strategies. We wanted to drive two-way communication and close coordination with community members. We focused on how could we partner with folks to get vaccinations provided, to conduct testing, to make sure that therapeutics were widely available to individuals, and that we develop a public communications campaign that gave messages that resonated with people, right? Not everyone hears information in the same way. Not everyone has the same level of education or understanding about this. And so we had to do a lot to partner with trusted community partners to understand how we could get the message out. And so I won't go through all of the information on this slide because y'all know I do too much and I have too many slides to cover in 17 minutes. But I just wanted to highlight for you some of the ways that we've tried to achieve some equity in vaccines and medications. And one of the things I'll say about therapeutics and medications is research shows that for people who contract COVID, that the sooner you get on medications, the better outcomes you're likely to have. And what we found is that people have varying levels of access to different medications that are effective. We know that our prior president had great access when he got diagnosed, but not everyone has that kind of access to treatment. And so we know that it's incredibly important. The other thing that we did was to invest in our community health worker program. We worked with them to develop and deploy equity-focused capacities to build trust, access, awareness, and confidence among individuals who are historically marginalized. So we used our community health worker program. We also worked with the Farmworker health program, the Healthier Together initiative, and also we had different work groups that we partnered with. Most of you all, are you familiar with community health workers? There are probably some of you in the room. But community health workers are frontline public health workers who are trusted members of their community, and they usually have very close relationships with and understanding of their local communities. And so the community health workers are all over the state of North Carolina. We have more than 500 across our 100 counties, and our recent data shows that they've touched almost 2 million lives. The Farmworker health program. So this program is designed to improve the health of migrant and seasonal farm workers and their families by providing funding, training, technical assistance to a statewide network of outreach and healthcare providers. Our farm worker healthcare program has been instrumental in getting vaccines administered to thousands of individuals. And they have hosted dozens and dozens of events in order to reach historically marginalized communities and farm workers. Healthier Together. Go back. To more effectively reach and vaccinate historically marginalized populations against the COVID-19 virus, the department identified the need, as I talked about earlier, for stronger on-the-ground connections in the community. And as a result of that, we formed and implemented the Healthier Together initiative. It's a public-private partnership with North Carolina Counts, which is a 501(c) organization. And the goal was to increase the number of individuals who are Black, Indigenous, and people of color who got the vaccine. And NC Counts has invited a number of organizations to partner with them in this effort, and they have been incredibly successful in their work with us. So, how will we address health equities at the state level? I got too many pieces of paper here. So we have developed an equity framework that's focused on earning and sustaining trust with our community partners, embedding equity in our policies and operations. And let me just stop there for a second, because if we don't change how decisions are made, how money is allocated, who is in decision-making positions, we're going to continue the problems that we've experienced so far. And so when we talk about embedding equity in policies, I would challenge you to look at who's in your organization. I worked for North Carolina Medicaid until 2 days ago. And what we discovered, and again, the George Floyd's death caused us to step back and take a deep look into our operations. What we discovered is out of a 13-member executive team, there were 2 individuals who were Black. Most of the others were Caucasian and predominantly male. And so we knew that we weren't going to kick people out of their jobs, right? Right? So we had to find another way to try to infuse diversity in our executive level. And so what we chose to do was we created a Diversity, Equity, and Inclusion Council. Fortunately, the person who was elected as the chair of that council was an African-American male, and we know that African-American males are not well represented in the human services field. So we made the decision that that person would be added to our executive team. He's not at a level in our organization that would necessitate that he would be at that level, but we wanted to be very intentional about what we did to address equity. The other thing that we did is we said we're going to look at our hiring policies. That's something we can control. So we said we were going to only promote, we were going to only post positions internally for the first 5 days of a posting, that our internal staff would get the first shot at any job that we had available, because we wanted to create an opportunity for upper mobility. Because one of the things that we know, and I'm going to stay here for just a minute, is that access gives you privilege. Access to people in power gives you privilege. And if we surround ourselves with people who are only like us or who are not diverse, then we're going to promote those people into upper management. We get to know people, we get comfortable with them, we know their capabilities and their skills, and there may be others in your organizations who are quite competent. You just don't happen to know that because you're not spending enough time with them. And so we were really intentional about embedding equity in our policies. The other thing we do, and then I'll move on, the other thing we did was to look at our policies and we have advisory committees at the state level. We examined who's on our advisory committees. There's some advisory committees that we have that there is no racial diversity on those advisory committees. That's a problem. Who is on your advisory boards? Who are in decision-making positions within your organizations? Those are ways that you can impact equity far beyond COVID-19. But I think we can learn from what COVID has taught us is that we need to make sure that we have diverse individuals throughout our organizations. People can look at your organization and see themselves because they're represented in your organization. So building trust is a part of our framework. Embedding equity in our policies and our operations is another part of our framework. And then having shared accountability. We know that data is incredibly important, and that was one of the things that we did as a state, is we did a lot of data evaluation. We collected a lot of data, we analyzed a lot of data, and that's what helped us to understand and to know with great confidence that we needed to do better and we needed to do different with getting COVID vaccines out to people who were historically marginalized. So I'm going to go quickly through the remaining slides. This you may have heard before. I wanted you to know sort of who we identify at the state level as individuals who are historically marginalized. It is individuals, groups, and communities that have historically and systemically been denied access to services, resources, and power relationships. That's what I was talking about earlier, having access to people who make decisions at all levels, political, social, and otherwise. And cultural dimensions as a result of systemic, durable, persistent racism, discrimination, and other forms of oppression. It is long-standing and well-documented. Structural marginalization has resulted in poor health outcomes, vulnerability to harm, and adverse social, political, and economic outcomes. And as I mentioned earlier, historically marginalized populations are often people who are racially, ethnically, and socially diverse. The other thing I just want to draw your attention to quickly is social drivers of health. And so we look at social drivers of health as those conditions in the environment where people live, work, learn, play, worship, and age that have an active impact on their health. I read something recently that said, and I think I'm quoting this correctly, that about 80% of a person's health outcomes are determined by non-medical drivers of health. Food, transportation, housing, those kinds of things have a tremendous impact on people's health, even more so than access to medical care. So I know it's been weighty. I'm glad y'all were finished eating because I thought maybe I'll give people indigestion, talking about all this really heavy stuff. And so I said, is there any good news? I asked myself, is there any good news? What do I have positive to leave with the team? So one of the things that I would say is that the White House has gotten on board and identified maternal health as a key priority. They're encouraging states to expand postpartum coverage. They've identified, I think there's probably as many as 11 or 12 states who've already taken action, including the great state of North Carolina. We're doing good, y'all. We're making progress, at least. The American Rescue Act, Plan Act of 2021, offered states the option to extend postpartum coverage to 12 months. And recently, our North Carolina General Assembly approved that option. And so now pregnant individuals can receive 12 months of postpartum coverage regardless of their Medicaid eligibility group. And that's 12 months compared to 60 days. The coverage begins the date the beneficiary's pregnancy ends and will end on the last day of the month after their 12-month postpartum period. This new coverage began on April 1st of this year, and I hope that you all will go to our website and learn more information about it because there are women who might currently benefit, who recently thought that they're losing their eligibility. The other thing about this postpartum coverage, it is full Medicaid benefits. Previously, Medicaid for what we call pregnant women was limited to care related to the pregnancy, and now women can have full Medicaid coverage as a part of their postpartum. The other thing that is happening in the state of North Carolina is we are implementing the first in the nation social determinants of health program, which is designed to improve the health of Medicaid beneficiaries while reducing costs. And so on March 15th of this year, we launched our Healthy Opportunities Food Program in 33 North Carolina counties. And some examples of food services here are listed. People can have access to fresh fruits, fresh vegetables, medically tailored meals. And then on May 1st, we launched our Housing Services Initiative, and we plan on June 15th to launch our Toxic Stress Services. And so North Carolina has approved up to $650 million to support Healthy Opportunities address non-medical drivers of care. The other thing I want to talk a little bit about is language access, which is something that is also a priority of ours. It needs more attention. We need to make sure that materials that are available in English are also available in Spanish. Or if you have another population that's large in your area, then we want to make sure that people can read and understand the materials we have available. So the department has received some funding through August of 2023. In one place I saw it said 2024, so I'm going to have to check my notes. But we've got a CDC disparities grant to fund language access that will enable us to help improve access to vaccine events, vaccine education, and other health-related education for individuals who do not speak English as their first language. So what do we have to leave for you this afternoon? What more can we do? I'm doing good, y'all. I thought I'd be like Pastor Maynard and saying, y'all give me a few more minutes. But I think I'm going to make it. I'm at slide 38. I know he's not going to mind me picking on him. So what more can we do? I think you're already doing it to some extent, because I read on the YWCA's webpage that you guys have incredible partnerships. You reach a lot of people and you don't do it alone. And so I would encourage those of you who are involved to stay involved and to make sure that you're engaged at the community level, working with community partners, grassroots organizations, to make sure that we're getting out messages that resonate with people and that folks can understand. We also want to make sure that we leverage our providers of color. This is another area that we're focusing on at the state, is looking at what are our contracting requirements. How difficult is it for a provider to respond to a request for proposal or a request for application? What we have found is often grassroots organizations, smaller community-based organizations, don't have the resources to respond to these elaborate RFPs. Or if they have resources, maybe they haven't done it before and they need some additional support to get through the process. And so we are partnering with providers of color because we want them to have a seat at the table, and we want them to have equal opportunities to get access to the wealth that's available in our country. We want to make sure that I encourage you to ensure that your approach is data-driven, that you prioritize equity data. I know that in some cases it's difficult to get race and ethnicity data, but we believe that that's critically important for you to understand who you're serving and are you able to achieve the outcomes that you're desiring. Improving language access is important, so making sure, as I mentioned, that materials are available in Spanish. Another nail on the head with developing and implementing a data strategy that you can follow. Seek to engage populations that are disproportionately impacted. And then what happened to the rest of my measure? Oh, I see what it is. It's measure the bullets underneath. I was going to say I was doing the most and made a mistake on this PowerPoint. That was not going to be good. So measure what kind of change and outcomes you're seeing among your selected populations. And certainly look at the gaps between those populations who have advantage and those who do not. So I ask myself, what do we want? Are we seeking equality? Historically, we know that not all communities have equally benefited from advances in science, in thought leadership. Not everyone has benefited from access to financial wealth. Health equity, on the other hand, so you'll see in this picture, equality is about giving everybody the same thing. But not everybody needs the same thing. People need what is necessary to help them advance. And so what we seek is to offer equity. Equity, health equity in this case, implies that ideally everyone should have a fair opportunity to attain their full timer. Stop. Oh, at the end though. Health equity implies that ideally everyone should have fair opportunity to attain their full health potential, and that no one should be disadvantaged from achieving this potential. If we don't build equity into our programs and practices on the front end, if we don't recognize the fierce urgency of now, the most powerless and vulnerable among us will not receive equity or justice. And so I say, you are doing the most. And I think it's a compliment, a definite compliment. And you're not trying to do too much. And so to the YWCA of Lower Cape Fear, we say thank you.